Good morning, good afternoon, everybody. Welcome to FSMA Fridays. I'm Brian Sharp with SafetyChain Software. It is great to be back. I get to be guest host today. So for those of you that I may sound familiar to, good to reconnect. And I know we've got a lot of new folks who have been joining us over recent months. So I want to welcome all of you back and appreciate you making time out of your busy schedules to be here today. We are going to continue a really important conversation around COVID and using this opportunity to do kind of a midsummer, mid-year check-in. Like many of you, we're approaching this halfway point of the year and trying to figure out what the rest of the year looks like. And that is when we lean on the experts at the Acheson Group, and we'll be doing that again today as well. So we've got a lot of really great content, some good updates, and some good conversation ahead. So we're gonna jump right in here. We know there's a lot of you that are just kind of finding FSMA Fridays for the first time. It's a mouthful, make sure I don't say that too fast. And we welcome you. For those of you that aren't quite as familiar with us, this is the longest standing industry update in the food and beverage industry. So we partnered with the Acheson Group about 6 years ago now. It's been quite a while. And our goal mainly is to get together once a month and talk through anything FSMA related around news, reg changes, updates and guidances that are coming out. And really, I think the real value comes as we start talking about the trends and best practices that we're both seeing with customers out in the market. And obviously the opportunity to have a live Q&A with the folks at TAG is one of the great advantages. So so we are glad you're here, and we put these on the last Friday of each month, and we hope that you'll continue to join us for those. Before we get started, just want to dig into a couple of quick housekeeping items that come up a lot. One is, while we have a lot of content today, so I'll turn it over to Ben and he'll run through that, but we will save some time at the end for Q&A as best we can. We often get more questions than we typically can handle, so we'll do our best, but rest assured that we'll share any other answers offline so that you can grab those in a LinkedIn group that we have, or we'll reach out to you directly as well. So we encourage you, as you have a question come up, go ahead and fire that away. There's a box on the right-hand side. Open that up, it on over. You'll notice only published to the audience. We have hundreds of people on each time here. So that'll just come to myself, and then we'll do our best to get to those at the end. So we really encourage those, and we'll certainly make sure we get back to you on the answers. I'll try and answer the first and most common question, which is yes, we are recording these. As we do all FSMA Fridays. So if you see on the right-hand part of the screen here, if you're interested in finding the replay afterward, you can go to our site at SafetyChain.com. Up in the top tab, navigation, there's a resources tag. You can drop that down and you'll see a list for FSMA Fridays. That will get you to not only today's recording, along with a link to the PowerPoint that we're using, but also the entire FSMA Friday library, which I believe now is over 100 recordings. So lots and lots of great content there that you can dig into. So all available, no cost. Go over there, check it out. If you're having any audio issues, sometimes that happens on these web meetings, as we're all have become quite accustomed to. You have two options. You can use your phone or the web. If one's not working, I know this sounds pretty obvious, the old plug and unplug, right? Try the other one. But if not, we have someone on our team, Ann Grace, who will be jumping in and help as best she can with any technical issues. So feel free to ask away. We'll do our best to help there. So as I said, we want to dig into kind of a COVID midsummer update. We're going to do that today with Dr. Ben Miller, one of the fan favorites. He's been a busy man and a really helpful resource for us, our customers. I know many of you, and his background, as you can see here, goes without saying that he's the guy we want in the room to have this conversation. So first, just want to welcome Ben back. How are you? And make sure you can hear me okay.
Thanks, Brian. Yeah, doing well. Glad to be back and excited to talk about some of the updates today and answer questions.
Yeah, sounds good. I'm sure there'll be plenty of both for sure. before we dig into the COVID side, one of the things we like to touch on each month is just a general FSMA update, kind of where this whole idea started way back in the day. So there's always some news, right? Food safety doesn't go away. So anything, Ben, that you and the tag team are keeping your eye on, or seeing any trends that everyone should be aware of?
Yeah, no, thanks, Brian. And as you said, food safety doesn't go away. It doesn't sleep,
Right.
unfortunately.
Yeah.
You know, everybody that's been tracking the news has seen, cyclospora outbreaks associated with produce. And, the reality is that as we continue to struggle with COVID, the world continues to turn, and those other pathogens are out there doing what they do. So, I think that just speaks to the need to maintain a lot of the food safety activities that we need to do on a daily basis, in addition to everything we have to do and work and contend with when it comes to COVID. So, like everything else in the world, it's complicated, and we just
Yeah.
have to keep on top of all of it.
Yeah, and we certainly know the folks that are on here understand that. So we have the leaders that are on here, right? Those are the folks that are on top of that. But it's an important note. I wanted to ask you also about something that from our side we've seen a lot of movement on, which was the reversal from GFSI around remote audits. And so for those that might not have done remote audits before or considered them, that's essentially using technology to be able to do an audit remotely, and it could be with a supplier, customer, that sort of thing. So this was a big deal, certainly for the certification bodies, but I'm just curious if you've been aware of that, been asked about it, or if you guys had any thoughts on that big change, that news that came out.
Yeah, no, great question. And Anna and I were chatting about this before the webinar started as well. GFSI calls it their information and communication technology, so ICT, and how to use ICT to conduct audits. And I think, that they've been looking at making this change prior to COVID, or opening up these options, but COVID really ramped it up, and they're doing it to allow kind of food and beverage manufacturers to continue to prioritize food safety while really maintaining some of those COVID safety measures. So, having fewer people on site as visitors if possible, or cutting down the amount of time that they would need to be on site. So,
Yeah.
they're allowing for a variety of technologies, so like what video conferencing platforms, but also the use of other remote technologies to do document review, or even portions of facility review. There is still, looks like, a need for at least a portion of the full audit. The annual full audit has to be conducted on site. And if people have specific questions about what is allowed under this kind of new approach, they should reach out to their certification program owners and have a discussion with them in terms of what that would look like. But I do think we're going to see a change, with in GFSI is kind of leading the way and making these changes. I know, we are doing more of this kind of virtual remote assessment work in some of the companies that we work with as well. So using kind of live video technology and remote record review. And certainly over the next year, as we continue to navigate the coronavirus situation, I think that's going to become more common. So.
Yeah. Yeah. Now we're seeing the same, and so I know for the SafetyChain customers that are on, I'd encourage you to reach out to your account manager and learn. We can share a little bit how some customers are starting to do this, and then we've also pulled together like a COVID specific tool set that could maybe help. So I think this is going to help a lot of people and save a lot of time too. So be interesting to see how that continues. But thanks for that update. So I think what we'd like to do here is jump right into what you're all seeing on the COVID side. We certainly know it's been, just as we were talking about before we started live here, just what a flurry it's been the last few months. And here we are going into July, believe it or not. So I'll turn it over to you. I know you guys have seen so much and had so many conversations. So we really appreciate you pulling this together on short notice for us.
Yeah, absolutely. So we'll go through quickly here, just kind of a look at what's been happening since states have started to reopen and how we're trying to sort of contextualize that risk using a matrix analysis that we've developed. And then, what is that impact in practical terms for the food industry as we start to see those case counts increase? And then talk a little bit at the end about the new CDC guidance on the critical infrastructure testing guidance that they've put out for facilities that are critical infrastructure that may have a confirmed case of illness in their facility. So again, this is a rapidly changing situation. I think we say this always, and it certainly feels that way. You start the week on Monday thinking that the week looks like something, and certainly ended on Friday, and it looks completely different from what you were guessing. So
Sure.
I think what we've learned with COVID is that I think Brian, you said leave your crystal ball in the trunk because
I did.
can,
I don't
it
have
can
it
be
anymore.
no, I know, right? It's a doorstop, but we do try to use the data to try to get a little bit or peek around the corner a little bit, and we'll talk about that here. But it's fluid, it changes quickly, and so much of it's driven by what actually happens on the ground. So with that, we've developed this risk matrix that I think a lot of people look at case count information coming out of states and say, oh, it's a huge increase in case counts, and that matters certainly in some ways, but it's really the rate of illness and the change in the rate of illness, and then what's the testing capacity and what's some of the infrastructure in these states to do test and trace and things like that, the things that we've been hearing about that matter in terms of if we're going to try to corner and control infection. And so we're looking at a variety of data sources. Some of what we look at is social distancing. So that mattered quite a bit when the states were in lockdown or shut down or under stay-at-home orders. Obviously, most of the states have moved out of that. But I think it's still relevant to look at where states fall in terms of how much movement there is within the population. And that data that we look at comes from the University of Maryland, and they get it from Google and Apple and the mobility data from people's cell phones. And so it's a pretty rich and robust data set that lets us say, okay, how much are people moving around in one state versus another? And then we look at the modeled effective rate of transmission for each state, and then the test positive rate, and create this outbreak index using those measures to look at sort of which states might be experiencing severe outbreak right now. And a lot of those you'll see align with what you're hearing in the news. And then maybe more importantly, which ones might be the next states to sort of move up into this highest risk category as we think about it. So this is the outbreak index here. Oops, looks like our slides. Let me see. Sorry about that. Let me just go to the next one here. Oop. Yeah, this little error in loading some of the data here, but what I can talk about is a lot of the states that we're seeing at this point in time, Arizona, Texas, Utah, South Carolina, and actually North Carolina, the states that we've heard about in the media tend to show up in this particular area of the graph. And this was data that came from the end of May. And so back in May, a lot of the states were down in this sort of medium risk quadrant where we saw the outbreak was under control. People were starting to move around more, but not necessarily significant number of illnesses occurring. Let me move to the next slide here. And this is the area, and again, the states aren't quite showing up well to see in this graph, but states that show up here in this medium risk quadrant are the ones that we're generally concerned about in terms of, as social distancing decreased, there was a risk that those states might move more towards the highest risk quadrant. And so this tends to be the area that we track in our analysis to identify states that could become sort of the next hotspots. And I think that's the information that the people that we work with and the companies that we work with really find useful, is trying to determine which states are the next Arizona, if you will, not to pick on Arizona, but which states might be headed in that direction, but that aren't necessarily today. I'm going to jump to this next slide. There we go. So, that was the picture at the end of May. As we come to the end of June, certainly we've seen a significant resurgence of illness in the US, and this is the epi curve for the entire outbreak that goes back to the beginning of March for the US. And you can see that this bar here, when I pulled this data yesterday, is actually the highest number of cases reported on a daily basis since the outbreak started. So we look like we're back into our, and if we call it a second peak or a second wave at this point. Most of these illnesses started in the Northeast and Mid-Atlantic region in April and May, and now we're seeing these outbreaks move into the South and Southwest in June here. So I think it's important to know that we're not seeing these increases just because we're testing more. We're able to tell that by looking at the data, and that's what this next slide should show us, is that, excuse me, this orange line shows us the number of tests that are conducted per 100,000 people in population. So you have states at the far end like New York and Louisiana, Rhode Island, Alaska, Michigan, states that are doing a lot of testing, but that aren't finding a lot of positives. And so that's what this blue bar shows us. That's the percent positive. So if you test 100 people in Louisiana, 3 will come back positive, versus if you test 100 people in Arizona right now, 20 will come back positive. So looking at that test positive rate, it gives us a sense of both, is there adequate testing? And if there is, what is the burden or rate of illness within the population over the last week? And so this is a really good measure to look at, where is the outbreak bad, where are the data good, and what can we draw from that? All right, again, this slide is unfortunately not popping the states up quite right, but what you see is, again, a lot of the high-risk states, the Texas, Arizonas, are in this high-risk quadrant because they have a high outbreak index, they have a low social distancing index. And if we went back in time and looked early on in the outbreak, many states were up here in this high-risk quadrant, but because people were staying home, and so there was much less, or there was much more social distancing going on. Essentially, that social distancing score, the higher it goes up, the more people are staying home based on cell phone data. So it's a fairly even split right now between this medium risk quadrant and this higher risk quadrant over here. And since last week, we've seen a number of states really move from medium risk up into the high risk quadrant. And again, we're trying to watch the particular area of the excuse me, yellow quadrant to see which ones might be coming up or moving next. Jump to the next slide. So this is the area, again, that we tend to look at. And right now, the states that are in this quadrant, there's just a few. Iowa is one of them. Missouri is over here, kind of bordering the high risk and medium risk quadrant. So there's a chance that those states may move up as well. And there's also a chance that they fall off. But right now, there's a big cluster of states here that you can kind of barely see with these little tick marks.
Yeah, hey, Ben, I think what we'll do for everybody who's watching, because those are really valuable. And so I wanted to ask you, is that chart available on your COVID page at TAG? That was first question. And second would be, if it's not, we'll make sure that we get a more clear image when we send out the deck so that people can link to it and see the updated quadrants there.
Yep, yeah, we'll attach a PDF of the presentation that'll show that a lot better.
Perfect, yeah.
To this deck. So yeah, I apologize that didn't project quite right here on when it got converted to Google, but we'll send that out so people can get a good look at the data, because it helps to spend a little time with it. But just from a practical standpoint, we're seeing an increase in cases. The majority of increases really kind of happening in the younger demographics, so people in their 20s, 30s, and 40s as states reopen. I mean, certainly seen that in the media, and that's what shows up in the epidemiologic data. The concern is that, as that age group gets infected, that there's a risk that spreads to more vulnerable populations. I mean, certainly we've seen the impact that has in long-term care facilities, and also the impact that it has in, the food industry, because a lot of people, in those age brackets work in food manufacturing or retail settings. And so they may be exposed in the broader community and then end up bringing that back into the workplace, which can be a challenge. Even if you have good programs in place, you still have to contend and deal with, who's a close contact of somebody that was a positive, and how do you manage that effectively, and how do you prevent that, prevent illness from spreading within your workforce. The other piece is that when we see those rapid rises in cases, it overwhelms the public health and medical infrastructure. And this is a graph that comes from the Texas Medical Center, taken just yesterday. And so, right now I'm probably tracking in Houston that they're concerned about ICU capacity, and exceeding ICU capacity here in the first week of July there. So it has a very real impact. And people, at the younger end of the age spectrum can still experience severe illness. It's not as common, but it can certainly happen. And so, hopefully there's a growing realization that the social distancing practices and those kind of things do make a difference. And it does matter in terms of limiting the number of cases that are happening in some of these states right now. Now, jump to the next slide. So from the food industry standpoint, we've been talking about what are the risk mitigation strategies that can be put in place in a food processing environment. Again, those increasing cases in the community can have a real impact on the workforce. And so having these programs in place is important. The employee wellness checks, the visitor wellness checks, talking about communication and training, making sure that people understand what they do outside of work can affect what happens at work. Again, those preventive measures like social distancing and then cleaning and disinfection, and then use of masks in processing environments and in offices too. As people return to office environments, the office environment can really represent a fairly high risk setting as well, if you get too many people in an enclosed space. Jump to this next slide. I'm going to talk here a little bit about the testing guidance that came out from CDC about a week and a half ago. And that really was designed to look at what's a good approach from employee testing if you have a case of COVID within critical infrastructure workplaces. So CDC gives a pretty good flow chart here, I think, that identifies different tiers of workers. So tier 1 would be like close contacts. Tier 2 would be people that may work on the same shift, but wouldn't otherwise be considered a close contact. And tier 3 would be others that might share a common space or something like that within the facility. And so for tier 1, they really break it out into 3 different strategies. So baseline testing with a 14-day quarantine period with symptom monitoring recommended. That's the most conservative strategy. And then they allow a little less conservative approach, which is baseline testing and then retesting 3 days after, again with symptom monitoring occurring. And then a little less conservative is just one baseline test if you have a critical staffing shortage. But I like the model in the sense that it gives companies some options to think about how do you use testing in a way to maybe bring somebody back sooner than 14 days if they're critical to the operation, but still provide some level of assurance that they may not be infected. And again, the concern right now is obviously asymptomatic transmission, and that's not going to get picked up on an employee wellness screen. So this is another tool in the toolkit, I think, to help people effectively manage the health of their workforce. So with that, I think that takes us to a little bit, we're going to go kind of predictions as we look into or this next month and then into the fall. So in July, we'll come back and talk at the end of July. I think we've got another one set up for July 31st, so we'll be able to see how close we were in terms of predicting things correctly. But there's definitely been a move in the last few days to look at restriction of travel between parts of the country, and will we see that increase? And the question is really, how does that affect business travel and commerce if you have the northeastern part of the country requiring quarantine from people coming from other high-risk parts of the country? And then I think we'll continue to see some emerging science on antibody testing and vaccines. There have been some encouraging vaccine trial information coming out both in the US, the UK, and China. And I think Dr. Fauci talked earlier this week about potentially even having a vaccine that could enter large-scale production by the end of the year. So hopefully that holds and continue to be able to learn and talk about that. So as we look into the fall too, what does that look like? A number of states are thinking about what does returning to school look like, certainly for K-12 colleges, and what does that have? What does that mean from a workforce impact standpoint? Some of the good news is that the emerging epidemiology, certainly for elementary age children up to middle school and maybe even high school, suggests that there's not a lot of transmission between children in that age group, and that there's not a lot of transmission from children to adults, but that there may be transmission from adults to children. That's some studies coming out of China and Europe that have looked at that. So that may be encouraging. I do think we've seen, as we look at colleges, some outbreaks that have happened, certainly in sports settings and things like that. So as colleges look to bring students back in person, that might also mean an uptick of illness in certain parts of the country this fall. Obviously, there's workforce impacts too, as people continue to work from home. They have school-aged children at home and things like that. If schools aren't able to be fully back into session, that will continue to put pressure on employers in terms of managing and allowing people to work remotely. So many parts and moving pieces, but I think another reason that we've seen potentially an uptick in cases in the South and Southwest is that summer there right now, it's hot, people are spending more time indoors, and therefore the risk of exposure goes up. We know risk is higher in an indoor environment. Certainly as we head into the fall, that risk shifts back to the northern climates as people come together and spend more time indoors. So I think this fall is going to be, it could be a little bit of a bumpy ride, depending on the way that things fall out. So something we're going to continue to look at and monitor. But that takes us to the end, Brian. Appreciate it. And we'll, like you said, we'll get those slides out so people can see in more detail the actual data on the state.
Yeah, the state data would be great. And again, we put the link up, and we'll include this link as well. That's been a go-to for us and a lot of customers. So we appreciate how much, if anybody has been following them, the amount of updates and content you guys have all been sharing at Acheson Group has been really helpful. I know we've got some questions, and as I sift through these here, Ben, I just was curious for you, what's the most, I mean, there's so much information out there right now, which is also part of the challenge, but what are you hearing the most concern about, or what advice are you giving most often to those you're working with on the ground?
Sure. I think right now a lot of the concerns that we have are around travel. So when is it safe to travel, either for work or for vacation? It's summer and people have employees going places, and people are still certainly getting on airplanes and flying. And I think that's a tricky question, especially when you're looking at somebody that's traveling on their own time. I think there are ways to manage risk when it comes to travel, but if people are going to get on an airplane, going to move through airports, it's really hard to maintain, social distance or physical distancing consistently. And so, we've been recommending looking at that CDC testing approach as one strategy that somebody might consider, to give them some assurance as people come back to work without requiring them to quarantine for 14 days. You could look at that strategy to approach for testing. So when somebody comes back from vacation, they could do a baseline test, and then maybe keep them out for work for those 3 days, have them tested again. And then when you get 2 negative tests, you have some confidence that they can come back to work in a fairly safe manner. So, I think it's looking at what resources are available and adapting those to those specific situations. I think that the overall challenge right now is that, just given the level of illness in the US, anytime you're traveling sort of out of state, in close contact with others, it is a high risk activity from an exposure standpoint.
Yeah. No, that makes a lot of sense. And I would add to that, just from what we're learning from our customers, we're trying to do as many interviews as we can. There's some really innovative things all of you are doing. It's quite inspiring. But one thing we've heard and helped what little we can is just on managing all the data, right? So they're treating their employee testing much like they've done their food testing, and making sure they understand it, that they have visibility into it, and they can make decisions on it too. So it's one thing to test, and then you learn real quickly, oh my gosh, there's a lot of data here. So what we've been seeing around that innovation has been quite impressive and helpful. So something to keep in mind as you start one of those testing programs, and that flow chart is helpful. I have a question here, Ben, on kind of a specific tactical one around cleaning, and this may get a little too into the weeds, but there's a question around is electrostatic the best technology for disinfection for COVID intensified cleaning? Is there any guidance on that, or any feedback? Or
Yeah, definitely devil's in the details, and whenever answering those kind of questions, it's certainly a technology that's been embraced and used in the airline industry for cleaning aircraft between flights. For certain applications, it can work well, and then for others, it may not be as effective as some other approaches. So you really have to look at the context of what you're trying to accomplish. What's the environment, and what levels of contamination might be there. So
yeah, got it. Okay. I want to recognize we're at the bottom of the hour. So for those of you that would like to hang on for a few more questions, we'll take a few here, and as I mentioned in the opening, we'll take the rest of them offline to our channel. There's also a group online at LinkedIn group for FSMA Fridays, so we'll make sure and get those posted there as well. And definitely want to thank you, Ben, and the Acheson Group for all the help and information you've provided over these last few months. It's just been very valuable. It's really important. So thanks for pulling all this together as well. If we have time for a couple more, I just, good general question, just what's your position on wearing masks? They're getting mixed messages, and just curious if you have any position or advice on masks in the plants.
Yeah, it's become such kind of a contentious issue in terms of, from a political standpoint. And I think some of that's driven by the fact that the science on it isn't 100% clear. When we look at the reduction in individual risk, there's really not many studies out there that tell us a lot about the benefit conferred by wearing kind of loose-fitting face coverings in a more community setting. A lot of the research that's out there looks at clinical settings and surgical masks in particular. So I think there's critics of that would say that there's just not a lot of good scientific evidence to demonstrate that it's really protective. I think the other side of that coin and the other side of the argument is that it appears that based on a study that was published recently in the Lancet, that was a meta-analysis of looking at a large number of papers, that there did appear to be some benefit from a disease reduction standpoint, or sort of a transmission standpoint at a population level. The confidence in that was, they rated as very low, but they still said that there appeared to be some effect. And so it's more of a public health question than an individual risk protection question, but it requires everybody to sort of participate for that public health function to work, if you will. So I think when you look at the burden of wearing a mask, and there are trade-offs, there are definitely burdens. They're not comfortable. They can make it a little more difficult to breathe. But that there is some emerging evidence that suggests that if everybody wears one, that you can reduce the risk of transmission, especially in an closed indoor air environment, to some extent. So it's a risk-benefit trade-off. I think the science is starting to come down on the fact that the benefits outweigh the risks or the inconvenience. So it's a recommendation that we make, that if really drive towards as close to universal mask usage in a processing facility as you can, and that should reduce the amount of large droplets, and even potentially maybe cut down on some of the small droplets that are exhaled during just regular breathing and talking.
Right. Okay. Good. Thank you. And didn't mean to put you in a tough spot on what's a very hot topic, I know, but it was a fair question.
Yeah,
last one I'll throw at you here, Ben, is from the CDC standpoint, what are their expectations right now around, quote, deep cleaning, either routinely or after, in particular, as we're talking about here, after there's a positive COVID case? Is there anything specific around that from them?
Yeah, they haven't, I think, was it last month? Well, in the last month, the CDC came out and said, well, fomite transmission remains a source of transmission. It's not the primary source of transmission. And I think people took that to mean that, don't worry about surfaces anymore. And that's not what it meant. I think they were correctly stating the science. It's more person-to-person transmission in terms of, sustained close contact. So cleaning and sanitation still matters. There is a risk of transmission through fomite surfaces. So cleaning and disinfection on, a fairly regular basis does help reduce risk, especially if you're in an environment where there's symptomatic people, where there might be large droplet spread. So yeah, I think there was a risk in that communication of people saying, well, I don't need to clean and disinfect anymore, and not true. It's still a good part of a COVID management program.
For sure. Very good. Well, listen, thank you again, Ben, for everything. I know there's probably a few more questions we didn't quite get to, so we appreciate everyone's patience. We'll get those posted in the LinkedIn channel. So again, if you go over to LinkedIn groups, look for FSMA Fridays, we'll share those. We'll also be sending out a link to this recording along with the deck, and we'll make sure that those slides have all the state detail in them. They were just a little hard to see on the screen, so we apologize for that, but we'll get the full printed version out as an attachment there. So thanks for all your work and being great partners and a big help to the industry, Ben, and we'll see you next month.
Yep, sounds good. Thanks, Brian. Thank you, everybody.
Right.
Have a good weekend.
Yeah.
Bye.
Thank you, everybody. Be safe out there, and we'll see you next time.